Hello everyone and welcome to NEET Mentor. This session is dedicated for DNB expected cutoff after seat increment. So we are gonna see OBC, UR, EWS and SC/ST expected cutoff. So this video will give you fairly good idea. Depending on your rank, you can do analysis and can do prediction as well. That what you can expect and in which round you can expect. So that's not sufficient. Getting the seat is not sufficient. Getting the best seat, and you should not regret after getting the seat. There are many factors, particularly if you are going for DNB. Academics part, hands-on, patient load, work environment, toxic, how much toxic it is, and all such things matters a lot. And you should also know how good is particular hospital for particular branch. The hospital might be small, but if it's specialized in particular department, then you can go for it. Okay, so for that you can avail our paid counseling guidance. The counseling may start in the beginning or by mid of July. So don't wait until the counseling notification. Once the counseling notification is out, all the paid members that we have taken, okay, they will be very much aggressive in getting know about all things, how it will go out about. Even we have explained them. It's human nature. So you should get the service availed before the counseling notification is out. And NMC or NBE or MCC won't let you know that on this date I am going to announce the schedule. They will just announce, and then all the things will start as of sudden. So for the packages, you can visit neetmentor.co.in and you can avail it. In case you don't want to avail the packages, some support you would be needing. So for that you can avail our smart portal counseling, which is very cheap, just 3,000, and you can get to know about the last year cutoff, its details, hospital details. You can't have a discussion, but still you can get the updates from there, real-time updates, fee structure, bond details, stipend details, and many other things. Talking about DNB branch-wise expected cutoff, so the most important part is how much shift is going to take. So what are the different factors it depends on? The result is out, we know the merit, okay, so it depends on the seat availability. And what is the other factor? Seat got incremented, that's one factor. Other factor, how aggressive the candidates are to take the seat this year. So what are the different factors it depends on? It depends on, let's analyze. It's more than 3 months already since the result published. So the candidates who had a thought process in mind that I didn't get the desired score or rank up to the potential, or those who had their first attempt, they must have started the preparation. And as per my knowledge, many are already in the middle of preparation. If next year is going to be NEET PG, they will mostly continue with their preparation, and their aggressiveness to take the seat will be lesser. So they will take it more defensively, that I am particular about this branch. If I get it, then I will go, or I'll try until a stray vacancy and all such things. So in that case, you will happen to see more seats available until mop up or stay round. But another case, it's going to be next in 24, many candidates do not want to take extra risk. Even though it's going to be next for everyone, if there is any impact, it will be for everyone. But how good a particular candidate is to get settled into new system, new pattern, will decide the fate. So the candidates will definitely be more eager, or they will take it more seriously to take the seat out of it. So there is chance that less number of seat will be available up to mop up or stay vacancy. So it's gonna impact mop up shift and stay round shift. So these are the two factors, and other factor is seat increment. So let's see if there is seat increment and candidates there is going to be NEET PG in the next year, then how is going to be the shift. Talking about the least demanding clinical branch, anesthesia, it will definitely have around 3.5 to 4,000 shift, because we have seen government seats have increased by 1200, and then around 750 DNB seats. You have diploma as well, diploma in DC, diploma in child health and DGO, and then DMRE. So in the good hospitals or private hospitals, they would prefer DCH over anesthesia in the very far or remote hospitals. Okay, so considering these factors, and many candidates would also go for, instead of going for DNB, they can go for MD in low budget private colleges. So this would definitely result in 3.5 to 4,000 of shift, and ENT would take around 3 to 3.5, ophthalmology around 3 to 3.5 thousand of positive shift for general category candidates. DNB psychiatry has less seats, but still you can expect 2,000 to 2.5 thousand of positive shift. DNB general surgery, you can expect 2,000 to 2.5 thousand of positive shift. In DNB TV chest, the number of seat is less, but still you can expect 1.5 to 2,000 of positive shift. In orthopedics, considering the pass ratio is lowest in DNB, you can expect 2,000 to 2.5 thousand or even more positive shift, because candidates would realize once they get the seat allotted that okay, the passing rate here is not good, so they won't join, and the seat will be coming down to third or fourth round. In gynecology, since the seat has increased maximum among all the clinical branches this year, it will also go up to 2,000 of positive shift. Pediatrics also expected up to 2,000 positive shift. DNB general medicine, you can expect between 750 to 1,500 positive shift, and DNB dermatology, although the number of seat is very less, still you can expect 500 to 1,000 of positive shift in dermatology, and these all calculation will be applicable until stay vacancy round. Radio diagnosis, you can expect positive shift by 500 rank. Okay, and in emergency medicine around 2,000 positive shift. In DNB pathology up to 5,000. So if you see the figure, DNB radio diagnosis, and it depends on you that what is your plan, whether you are ready to go up to stay vacancy, because if you go for a stay vacancy, you don't have option to do the fresh choice filling in a stay vacancy. Whatever choice you do in mop-up round will be carried forward for a stay vacancy round. So if you are really taking risk, or you have backup as next year preparation, then you would do some choice filling where you don't get the seat in mop-up round and you get seat in stay vacancy round. People get very happy seeing the cutoff of stay vacancy round, but they must understand the process or the pain or the risk the candidates have all taken, those who got good clinical subject or the dream branch in a stay vacancy round. Because if you do choice filling in mop-up round with backup branch, you are expecting to get the seat in mop-up round itself, so you won't be able to reach to stay vacancy round. So those who are reaching to stay vacancy round, they are taking very calculative risk, or the candidates are those who are already doing the preparation for next year, so they have the leisure to take the risk. So more risk, better gain in stay vacancy round, but it's not applicable to all. Those who are very rigid to take the seat in this year, they won't be able to take that much risk. Okay, because nobody knows how many seats will be available in a stay vacancy round. So you do the choice filling to get a seat in mop-up, and if you get a seat mop-up, then you don't go for stay vacancy round. So those analysis and approach is very important for the counseling, because ultimately what you give to the counseling authority is the choice filling, nothing more. So when you give what choice filling, okay, which colleges you have included, and in which sequence you have put those colleges, and what analysis you have put. If any institute is very renowned, but you know that you are not going to get hands-on in that hospital, have you included or you have not included? Even you get like a renowned institute, corporate institute, whether you regret after getting it, you will regret if you don't have done, if you haven't done the analysis. Okay, so radio can go up to 8,000, dermatology up to 8,300, general medicine can go up to 15,000, and many candidates are ready to sacrifice anything to get DNB general medicine, no matter where they get the seat, because it's such kind of branch. Up to 15,000, if you're getting free seat, DNB is free seat. Whether you get government or private, doesn't matter. You have to pay equal amount of tuition fee. So you are getting free seat up to 15,000. That too degree in general medicine. That's kind of like a reward. So the candidates, I have spoken with many candidates who are ready to take any seat anywhere in India if they get in medicine. They are ready to sacrifice the institute, but not for other branches. But they are ready for medicine, because in medicine you can learn on your own, and you don't need one-to-one learning, and surgical exposure is not required. Okay, and any hospital will have maximum exposure in medicine branch. DNB pediatrics, where the passing rate is lower, on the lower side, it can go up to 19,000. DNB obs and gynae up to 18.3 thousand. DNB orthopedics can go up to 27,000. DNB TB and chest, it can go up to 17.5 to 18,000. General surgery can go up to 24.3 or even higher. DNB psychiatry around almost 25,000. DNB ophthalmology approx 34,000. DNB ENT 29.5 thousand. DNB anesthesia up to 37,000. DNB emergency medicine up to 24,200, and pathology up to 60,000, 62,000. Similarly, you can see the expected cutoff for OBC, EWS, and SC/ST. So, what is difference compared to last year in OBC, EWS, SC/ST? We need to see the category-wise rank improvement. So last year on particular rank, how many category candidates were there, and this year in the same rank, how many candidates are there from particular category? If more candidates this year, means you are going to get loss in the category, means your category rank is degraded. If less number of candidates in a particular all India rank, then your category rank is improved, means competition is less, so you have benefit in particular category. This year in EWS there is a little more competition than last year, but in OBC, SC/ST the competition is little lesser compared to last year. So you have one benefit in the category compared to last year, and other is seat increment. So considering all the factors, this is what I have created, and hope it gives you fairly good idea depending on your rank where you stand and what you can get. Similarly, I will publish a video for NB diploma. So I have already published all India quota MDMS expected cutoff. This is DNB and NB diploma. After these three videos, if you are still not getting the seat or not able to get idea, then you need to open up the chances of yourself getting into low budget private college or a college with a particular fee. So I will be creating separate video with low budget private college up to 15 lakhs or something like. Okay, so this series of videos will give you very clear idea that where you stand, and before the counseling starts you should have a clear mindset, and still it doesn't give you clarity, then you can talk to the experienced mentor, counselor one-to-one, and can enroll with their help paid services to guide you through step-by-step counseling procedure, so that you don't assume anything. I have seen many candidates, due to lack of information, due to lack of knowledge in or analysis, they assume few things and they proceed. That assumption are like glitches, and when you see the result, those glitches will hurt you. Okay, so don't go on assumption. Read the rules properly and do the analysis properly. Okay, so that's how you should proceed in the counseling. So that's all from my side. Thanks for watching. Have a nice day.